Hello, I'm Dr. Christopher Burrow. I'm the EVP of Medical Affairs at Humetrix, and I'm here today to introduce and speak about the Humetrix iBlueButton apps. The purpose of these apps is to allow a patient to receive from a provider system a set of medical records that they can store, display, parse, and aggregate on their iBlueButton app. So the way this app works is it's fully compatible with the direct standard, and in addition to which this app can aggregate structured data from the Medicare Blue Button record as well as from the VA Blue Button record and the TRICARE DoD Blue Button record. Those records come into the app as structured records. In the case of VA and DoD, they are actually C32 CCD XML files, and so the app can parse and display those records in a compelling way. So in the scenario that we've built today, we have a patient who has been receiving care both at a military facility, at the VA, as well has been seen in various private practices where, because the patient also has Medicare, the Medicare Blue Button record provides a wealth of information for the patient. So in today's story, this patient who has multiple medical problems has suddenly fallen ill and has been transported to another point of care where he's never been seen before. And so in our example today, that point is the UCSD, University of California, San Diego Emergency Department, where the patient has been seen by a physician who has, to this point, no other records. However, all is not lost. The patient turns up with their iBlueButton app, and in launching the app, which runs either on an iOS, Apple device, either an iPad mini or on an iPhone, or on an Android device, the patient can simply show the physician his medical records. So the app is easy to use, it's password protected. All the data stored on the app is AES 256 encrypted, so it's safe if your device is lost. And this particular app lets you create for your family multiple different patient profiles. For example, yourself, your children, your parents. In our example today, the patient will be Rick Jones. For each of the records, the app allows the patient to view the record, allows the patient to also view not only the Medicare record, but also the DoD record and the VA record, shown here. And as a result, all of the original records are on the device, stored locally and securely. The app also provides a summary record view where all of the patient's medications are laid out, whether they're from self-entered medications or, more importantly, whether they are medications that came from the Medicare record or medications that came from the TRICARE record or medications that came from a VA record. Same thing with conditions, all laid out as to where the provenance of each data element is from. So as a result, the patient has a pretty comprehensive view of their medical record. Now, when a patient is seen in a hospital, the patient can receive a push using Direct, as shown here, where a physician using the MirthMail service of San Diego Health Connect is able to upload a file, in this case a CCDA, and send it directly to the app. And when that particular record is received, the patient can then look at the record and can view that record that's been imported. So here would be the record received from UC San Diego. So as a result, after that encounter, without requiring the patient to go to a portal, the records come in directly into the app and can be viewed immediately by the patient and the physician, so that the physician can be confident before the patient goes home that they have all of their records. So what we've seen today is that a patient using the iBlueButton app can directly receive from multiple data sources records that the app can aggregate and display. This gives the patient in their hands a complete medical record that they can use to ensure safe care and coordination of care as they are seen by different providers following one encounter or multiple encounters. Thanks very much.